you all. My name is Jorge Salinas, hospital epidemiologist for the University of Iowa Hospitals and Clinics. We wanted to ensure that everybody is reminded of the safety measures necessary for the upcoming Labor Day weekend, especially in the current situation of relatively high incidence of COVID in the community. So I'll be happy to take some of your questions that Laura will moderate and will be monitoring the chat.
Hi, this is Kate with IPR. Dr. Salinas, is it too soon yet to know if we've made it past the initial surge of cases on campus? Just give us an update of how that's playing out in Johnson.
Correct. As you allude to, most of the cases in Johnson County are among very young individuals, ages 18 to 25 or so, and many of them are seen at our facility. In our facility, we saw a relative peak in the number of infections among young people about a week ago, and since then the number of cases has decreased to some degree, but we're still hovering over nearly 100 positive cases a day, which is still a very large number. So the numbers have decreased some. Some could see that as some good news. They have stopped increasing, and they have decreased some, but over the last 4 or 5 days, we've seen a relative plateau. The number of cases is still somewhat stable, not growing, but stable. But still at a relatively high number. 100 a day is still a meaningful number for sure.
Tony, did you have a question?
Among those, among that younger population that you are still seeing positive cases in, what seems to be the driver there? Have you guys established how they are coming into contact with COVID, and what are the recommendations for dealing with whatever activity is leading to this issue?
Well, public health authorities are in charge of conducting official investigations of the routes of transmission of COVID in the community. We can share our anecdotal experience of having seen, several hundreds of these young people, and as you can imagine, here in Iowa City and other parts of the country, in college towns, young students live in a number of them live in houses, fraternities, sororities, etc., where they share rooms, they share common spaces, they may have parties. And it is now, after so many months of this pandemic, we know very well how COVID gets transmitted and what increases the risk of a super spreader event or a large outbreak. And that is large gatherings in closed indoor spaces. And that is the classic definition of a good party. So it's clear that this socialization among young people has led to these large super spreader events, large outbreaks that have fueled the number of cases in the last couple of weeks that we're seeing in Johnson County.
Vanessa Miller had a question about, from the Gazette, had a question about that we've seen an uptick in people outside the younger population getting tested or testing positive.
Thank you, Vanessa. That's a very interesting question. It's very clear throughout the country. We have several epidemics. The Northeast is not the same as the South and the Midwest. It's the same in Iowa, and it's the same in our county. We have more than one epidemic. We tend to aggregate all of them and see an overall number and an overall incidence. But the reality is that we have one outbreak among young people, and we monitor daily the number of cases of other age groups, people younger than 18, people ages 26 to 50 or older than 50 that may have a greater risk of complications from COVID. but we have not seen an increase in the number of cases in any of those age groups, which is good news. The people that are part of, for example, the higher risk group, those that are older than 50, they come from towns that are outside of Iowa City, more towards the southern part of the state.
Hillary Ojeda from the Press Citizen. This may not be a question you're able to answer, but speaking to the daily average for the number of tests done for UI students, and whether that's stable, increased, or decreased.
Because I represent the program of hospital epidemiology and at the University of Iowa Hospitals and Clinics, I cannot give you a complete number, a complete figure of all the tests done at the university level. So we can only speak about the tests done in our facilities, and overall it's been stable over the last week or so.
Isabel from Daily Iowan TV, is it gatherings of more than 10 people that are prohibited, or should students limit it to even smaller groups than 10?
In general, the fewer people, the better. Fewer people means that the probability that one of the all other people attending the gathering of having COVID is smaller. At 10 or more, you have the chances that one of them is infected go up tremendously. So I would strongly encourage people to limit gatherings to less than 10 or fewer if possible. At the same time, given the very high incidence among young people, they should be very mindful of socializing, especially over the coming weekend, with people of other age groups, especially people older than 50 or those that have chronic medical conditions. You should be extra careful, try not to socialize with people that meet those characteristics. But if you must socialize with people of those age groups, preferentially do it outdoors, limit the number of people, use a form of face covering, a face mask or a face shield, um, practice frequent hand hygiene. But again, if as much as possible, try to avoid large gatherings, especially if they include people that may be in their more vulnerable age groups.
Question from Riley Wilson with the Daily Iowan. Is there any evidence as of now that closing the bars in Iowa City has made an impact on case counts?
I think it's very difficult to tell. It's very difficult to tell. I think it was an appropriate move. And it is one of those, as we described, a large gathering in an indoor space is one of the places where it's more conducive to a lot of transmission in between people. So it was the right measure to take, but it's difficult. The numbers have decreased some. It's difficult to tell whether it's as a result of this measure, but in general, when you are trying to tackle an outbreak, you cannot rely on one or two measures. You need to implement a package of measures, and you need to continue monitoring the results and modifying your measures until you get the results that you want.
Denny from KWWL.
Hi, Dr. Salinas. I just had a question for those students that are leaving, for vacation, this coming Labor Day, as you were saying. Are you worried about them leaving the county and then coming back in and maybe bringing, making more positive cases? What would you have to say to those students? Are you going to suggest them maybe quarantining themselves and maybe their roommates quarantining? What's kind of the process with them?
Yes, I am not very concerned about the possibility of them going places and bringing COVID, because the incidence of COVID in Iowa City and Johnson County, especially among that age group, is so high, is one of the highest in the country. The greatest risk is actually of them carrying COVID to wherever they go. So that's the advice that we want to give to everyone, that college age students that are part of, that live in a town that is having a high incidence of COVID, they should be extra careful about the way they socialize in the next few days. They have to be extra careful about visiting their family. They should avoid visiting their family if possible, especially if those people that they were planning on visiting may include persons that are older than the age of 50 or may have chronic medical conditions. So the risk is actually of taking the virus from where they're at currently to other locations, more than the other way around. Now that advice applies to colleges and universities that are having a high incidence of COVID. The advice may be different for colleges that are about to start or those that have not detected an outbreak.
Nick from KGAN. I may have gotten the station wrong. Nick.
No, sorry, I thought I was muted. Doctor, I was reading an article today from the director of athletic medicine at Penn State who said roughly a third of Big Ten athletes that have tested positive for COVID are shown to have myocarditis. These are obviously young, healthy people. Do you think the message is getting out to young people that while they may not be at risk of hospitalization or death, they could still face long-term issues from this disease because we just simply don't know enough about it?
Thank you. That is a great point. Young people need to avoid getting infected for multiple reasons. One, there are, even though it's less frequent than for older adults, they still have some risk of having serious disease requiring hospitalization, potentially dying. It can happen no matter what your age is. Second, they can, even if they have a very mild illness, by carrying the virus, they can infect others that may have a more severe disease. Third, as you alluded to, we are still learning every day about the nature of this virus and its long-term consequences. New studies coming out of Europe, for example, are showing that a large proportion of individuals have chronic symptoms related to COVID even after they've recovered or they've stopped being infectious. And studies doing magnetic resonance of the hearts of young people, even if asymptomatic, have shown, as you mentioned, evidence of inflammation. We don't know yet what the long-term effects of COVID on the heart are, but everybody, young or older adult or a child, should avoid getting infected.
All right, Michaela Ram from the Gazette has asked, do you have any concerns about the state's data or whether we have an accurate picture of the spread?
Thank you. It's very clear that having accurate data is very important to make good decisions. As you can imagine, it is very difficult to collect information from multiple locations. We have multiple testing platforms, etc. Also, public health didn't have perhaps the infrastructure for doing surveillance for COVID. It's a new disease, so they had to create it. And it's clear, it's been in the media that there have been a number of difficulties or challenges that they've had in the reporting and the accurate representation of numbers. So yes, I agree that we need accurate numbers. What I would tell you though is that even though the data may be partially imperfect, it's already helping us determine what the trends are. The incidence of COVID in Iowa is high, and the next few weeks are going to be difficult weeks for all Iowans, and we need to be extra careful to try to avoid getting infected so we don't suffer the consequences, or other people that we may expose don't suffer the consequences either.
Mary Green is wondering, with it being a holiday weekend and the last holiday weekend was our last holiday weekend was the 4th of July, what did Johnson County experience as far as infections transmission in the weeks following 4th of July? And with cases already increased in Johnson County at this point, how are the circumstances different for this holiday weekend?
Johnson County started experiencing an increase in incidents even before the 4th of July. The incidents decreased partially even after the holiday. It wasn't tremendously impactful. It didn't lead to another peak in incidents of cases, but it probably contributed to a more protracted epidemic curve, meaning that a prolongation of a relatively moderate or high number of cases over several days and weeks. So I think that that's a possibility. Right now, the risk is probably greater if people that live in a very high incidence area travel to other places that have low incidence. They can then seed and then further spread the disease to other parts of the state. So this is again a critical point for our state. We need very clear communication from the university and all universities, colleges, etc. Um, uh, People coming from high incidence settings, such as in this case, Iowa City and Johnson County, should be extra careful, should assume that they may have been exposed, that they may carry the coronavirus, and they should be extra careful in their interactions with vulnerable people, their family, especially if they are older than 50 or if they have chronic medical conditions.
Vanessa Miller from the Gazette is wondering, have we changed anything? Or Vanessa, can you clarify if you're talking about the university or us in particular that have changed requirements for testing?
Yeah, the universities specifically, if anything's changed with the increase in demand for tests, like symptoms wise and stuff.
So I can speak about the University of Iowa hospitals and clinics. And here we have the capacity to test anyone that has symptoms that are compatible with COVID. If somebody doesn't have symptoms but has been exposed to somebody with laboratory confirmed COVID, they can also be seen and eventually tested here as well. We test other patients that are about to undergo surgical procedures, for example. We test patients on admission. So our testing requirements and criteria have not changed at the University of Iowa hospitals and clinics.
Isabel with Daily Iowan. Universities like Michigan State have gone online completely, yet don't have nearly as many cases as Johnson County. Would it help decrease cases if UI went online completely?
Thank you. That's a very interesting question because it's a very complex one. I think that if the students were not here, yes, it could decrease the incidence here in Johnson County. However, now we know that many of them carry the virus, and what we would be doing is transferring the virus to other locations. So the problem has changed, has evolved. It has become a bit more complex. So asking students to leave town would not necessarily decrease our overall incidence as a state. Still going to online classes, especially for those colleges that have not started classes yet, is one of several measures that universities have to consider in conjunction with many others to try to prevent outbreaks in their campuses.
Michaela Ram has asked, do you foresee University of Iowa Healthcare implementing certain policies it did in March should cases keep increasing? Thinking specifically about suspending elective surgeries.
Thank you, Michaela. Yes, we have a surge plan, and we evaluate the epidemiologic situation with a number of parameters. And depending on those parameters, we are ready to modify our operations as we did in March, and hopefully even in a better fashion. Again, we have learned tremendously more about how this virus is spread and how can we prevent it. So we feel better prepared at the moment to provide a safe environment for our patients and visitors and staff here at the University of Iowa hospitals and clinics.
Michaela's follow-up question is, visitor policies will remain in place for the time being.
Correct. We are not modifying our visitor policies at the moment, but again, we review the epidemic curves, the number of cases, the demographics of cases on a daily basis, and there is always the possibility that we could modify those in the near future, but we are not planning on doing it just yet.
Isabel from Daily Iowan, do you foresee students coming back to campus in January? How would guidelines be modified if needed?
Thank you. Very interesting question. Again, as I mentioned, there are many factors that are being considered, but I am not part of the University of Iowa response or planning for classes in January, so I couldn't specifically comment on that. How would guidelines be modified? I mean, it's very clear that many colleges are learning from the experiences that they are going through, and it's very clear that these experiences will influence the way things are done in the future.
Is there anything else students should keep in mind this holiday weekend besides the stuff we've just addressed? Or if you feel like recapping, I mean, what are the highlights of what they need to be remembering if they're out and running about this weekend?
Correct. So again, I would want to remind everyone, especially if you come from an area that is having a large incidence of COVID, that you should try to avoid gatherings of 10 people or more. If you must attend a gathering, prefer gatherings that are done outdoors, wear a face covering, perform hand hygiene frequently, and try to continue practicing social distancing, especially from people that may be vulnerable if they acquired COVID, people that are older than the age of 50 or those that have chronic medical conditions. If we all practice those recommendations, it's pretty clear that the incidence of COVID in Johnson County, but also in all of Iowa, could decrease in the next few weeks. That's what is so interesting about the epidemiology and the prevention of COVID. We know the tools, we know what works. We just need to work together. If we work together as a society, if we exercise solidarity, we can bring the numbers down. But everybody has to do their part. Again, we need to sacrifice a little bit, avoid gatherings now so we can have them in the future.
Bo from KCCI, are you worried about the upcoming flu season bringing another case spike to the UI?
It is. There is always that possibility. We tend to monitor what happens in the Southern Hemisphere to try to predict what may happen here in the subsequent flu season. Interestingly, in the Southern Hemisphere, especially countries that have done a very good job at controlling COVID, they also saw a very minimal increase in cases of influenza. What that translates to is that in Iowa and in the United States, if we are able to continue practicing these common sense recommendations of social distancing, face coverings, avoiding large crowds, hand hygiene, the epidemic that we live every year of influenza may be milder this year. But if we try to continue our lives without using face coverings, social distancing, hand hygiene, yes, it could be very problematic. We could have two epidemics at once that rest assured that could be very problematic for our health system.
Kate Payne from Iowa Public Radio has another question.
Dr. Salinas, what do you make of Governor Kim Reynolds not acting on the White House task force recommendations, such as a statewide mask mandate and much more aggressive, consistent testing of university students and nursing home residents?
I remain hopeful that our authorities, both at the federal, state, and local level, will continue listening to public health recommendations, to scientific recommendations, to try to improve the health of people living in the state. So I am, again, I'm hopeful that they will continue monitoring the trends of COVID and that they will continue evaluating and hopefully implementing some of the recommendations that are coming from experts from the federal level.
Vanessa Miller was asking about I'm skipping Vincent here, Benny here. Has there been discussion with the university and UI hospitals on certain threshold for positive cases among students to shut down residence halls or in-person learning?
I am positive that the university is monitoring the epidemic, is monitoring the number of cases, and they have thresholds. Again, I am not part of the decision making for the University of Iowa as a whole. I'm the epidemiologist for the University of Iowa hospitals and clinics. But the same way that we do have metrics to monitor and to modify our operations, I am positive that they have some as well.
Vanessa was wondering about how hopeful you are about the availability of a vaccine.
Thank you. Yes, I am hopeful. Time will tell. There are a number of vaccines being studied. Some of them studied here at the University of Iowa um, and that are in phase 3 trials. We hope that those trials will be concluded in the next few months. After they are concluded, they have to be assessed for efficacy and for safety. And if they pass those thresholds, I would hope that we would have vaccines probably later in the winter. But again, vaccine development is a very, very serious business. We want to ensure that vaccines are safe and efficacious. And only once we meet those important thresholds or criteria is when we will have a vaccine for general use. I am again hopeful as everybody else that we will get there soon, but we should not try to cut corners. It could only hurt if we try to do it faster than it should be.